Good morning. Can you all hear me okay? Yes? Okay, fantastic. So I am very grateful for the opportunity to be able to speak to you more about what I do on a daily basis in my clinical practice, which is integrative oncology. My own background, I'm a medical oncologist, also trained in palliative medicine, and found integrative medicine to be something that brought together the symptom management, the cancer care, but really focusing on the side of lifestyle management, symptom management, to help improve outcomes in our cancer patients. So I'm going to share more about what exactly is integrative medicine as compared to other terms you may have heard, like complementary medicine, alternative medicine, also to understand how it can have a real impact on outcomes with our patients, both with regard to their cancer treatment, but also emotionally, physically, in terms of having them do better, not just during treatment, but after treatment. So a lot of ourselves, included, but our patients get bombarded with a lot of information, especially when they are first faced with a cancer diagnosis. Some of that information may be good, some of it might be not so good, and it can be really confusing and overwhelming, especially the way that patients get this information. Some of it might be friends, family, coworkers, people who really they love and trust and care for, and so they might not know what information is good, what information is not good. And so that's where integrative medicine can play a real role, and especially a consultation, for example, talking to an integrative oncology specialist about kind of sorting through that information, what is evidence-based, what's not evidence-based. Just as an example here, I'll show that there's a Time Magazine article here that says, Alternative Medicine, Your Guide to Stress Relief, Healing, Nutrition, and More. The challenge is that these terms of integrative medicine and alternative medicine are not interchangeable. I'll come to that definition to share because I see an article that says alternative medicine, and to me that means that it's not looking to the evidence. It's not evidence-based treatments that are being discussed there. But in terms of Time Magazine, Mayo Clinic, in that presentation of that article, they actually are presenting evidence-based therapies. And so there can be some of this, the terms are not interchangeable. So what are the terms? I think that would be a good place to start. So alternative medicine is something that is used in place of conventional medicine. Complementary medicine is used together with conventional medicine, and integrative medicine is used together with conventional medicine in a deliberate manner that is personalized, evidence-based, and safe. And so any treatment, depending on how it's used, even medications, there's a lot out there right now that some of you may have already experienced or heard from your patients about repurposing of drugs. So medications that have one purpose are being used for another purpose, and so a medication that is perfectly evidence-based and informed for, let's say, cholesterol treatment or the use of as an antifungal might be repurposed and used for a cancer treatment or other purposes for which it was intended. And so integrative medicine would be the evidence-based approach to using therapies. So I'll come back to, this is the 2020 National Cancer Opinion Survey that ASCO did. It's a national survey. It included cancer patients, non-cancer patients, and survivors as well. This 2020 survey asked generally of the US population, are alternative therapies a good supplement to standard cancer treatment? And the response, so 73% of individuals said yes. And then the other question that was more disturbing, the response, cancer can be cured solely through alternative therapies without standard treatments. 35% of the US population in that cancer survey said yes. So alternative treatments, not standard of care. If you go back to the earlier survey in 2018, they asked the same question, and in that survey, again, 4 in 10 Americans did believe that cancer therapies could be cured through alternative therapies, but in that survey they actually broke it down and found that it was predominantly in the 18 to 37 age group, so in that AYA, adolescent young adult group, 47% of individuals in that age group held that belief. So the question, what is happening to these individuals? Are they not coming to their oncology care teams? Where are they going for their cancer care? If we look at a survey that we actually did at MD Anderson in terms of the use of complementary and alternative medicine, I highlighted in that red box, this is a survey of 450 patients, predominantly in the breast center, melanoma center, and in our outpatient clinic. 88% of individuals were actually combining integrative therapies with their conventional cancer care. So this piece is also important to recognize that there are individuals who may be doing things even before their cancer diagnosis, but maybe starting things during their cancer diagnosis that may be good, may not be good, may affect the outcomes, may increase toxicity. And some individuals may already be holding that belief of, oh, an alternative therapy is going to be a better option than what my oncologist is going to recommend. And those thoughts don't just go away. They can persist. And so just here's kind of a catch-all, kind of basket of what complementary therapies can be. And they can be divided roughly into the categories of natural products, mind-body practices, and other complementary health approaches. And the reason I show this is these are all therapies that could be considered alternative, complementary, or integrative, depending on how they're used, depending on the evidence. And there's not equal amounts of evidence supporting all of these therapies, whether it's the use of supplements, meditation, yoga, exercise, or even going down to whole medical systems and other approaches like the use of traditional healers, Ayurvedic medicine, traditional Chinese medicine. So just because there's an integrative treatment doesn't mean that it has equal weight in terms of the recommendation that it might receive. So I'll come back now to a definition that speaks more specifically to integrative medicine and oncology care. So some years ago now in 2017, there was a Journal of the National Cancer Institute monograph where the Society for Integrative Oncology put together a comprehensive definition of what integrative oncology is. I'll read that out to you all. So integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and/or lifestyle modification from different traditions alongside conventional cancer treatments. It aims to optimize health, quality of life, and clinical outcomes across the cancer continuum and to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. So what does it look like to do integrative medicine in clinical practice? And so I'll briefly go into this just to give you some context in the clinical practice space. So at MD Anderson in our integrative medicine program, we use the biopsychosocial model to help guide the discussion that we have with patients. And so all of the different integrative therapies that are being offered to patients are alongside their cancer care teams. So for example, if we're thinking about supporting psychosocial health, we don't pretend that music therapy or yoga therapy is going to help someone's anxiety or depression by itself. It's in coordination with other teams like psychiatry, supportive care, pain management. Again, we don't pretend that massage, acupuncture are going to kind of fix someone's pain and that there's no other opportunities out there that are evidence-based for pain relief. So we do collaborate, again, with palliative care, supportive care teams, pain management teams. So it's about a comprehensive approach, collaborative approach, and not kind of a model where you actually have integrative medicine kind of working kind of alongside and separate from the conventional medical teams. And so at the beginning, in terms of how patients get to integrative medicine, it's considered a clinical service just like any other clinical service in the hospital. Referrals to come to integrative medicine, there's a physician evaluation, and patients have an integrative medicine care plan discussed and developed. We used patient-reported outcomes. So for example, there's one tool called the MyCall where we ask patients about what are their top interests in health that they want to discuss during the integrative medicine consultation. We also use other assessments like the ESAS, asking about symptom assessment and using that to base that integrative care plan on. And I'll just share that when we do have patients engage in therapies like massage or acupuncture, these are all opportunities for learning. And so we do assessments before and after these kinds of treatments and then use that to both guide our decisions in terms of is this a good treatment for the patient for the symptoms they're having, but then we also use that for clinical research. So pre-post ESAS, so asking about different symptoms that they're experiencing in the 24 hours before their intervention and then asking them immediately after how they're feeling in response to that intervention. With regard to lifestyle screening, and this is one point that I wanted to highlight in the talk today, which is integrative medicine, has been playing more of a unique role in supporting lifestyle interventions for patients, and there's more and more data pointing to the importance of lifestyle both for cancer prevention and also to improve cancer treatment outcomes, and as far as not just increasing that treatment improvement in terms of, for example, progression-free survival or overall survival, but there's also evidence in terms of reducing risk of recurrence. And so one of the pilot projects that we've done with a breast medical oncology center at MD Anderson is to screen every single newly diagnosed breast cancer patient and ask them about diet, exercise, and look at the body mass index. And based on the outcome of that screening assessment, patients will get referred to or not referred to integrative medicine for a further lifestyle discussion and then intervention. Intervention meaning anywhere from meeting with a physical therapist for exercise counseling, meeting with a dietitian for nutrition counseling, and then also potentially collaborating with a health psychologist to help with the behavioral change support. So this screening is integrated now as part of our general system in the hospital, and it's going to be moved on to other health areas, other cancer areas beyond breast cancer. So when patients do come to integrative medicine, we've asked them, why do you come to integrative medicine? I'll draw your attention to the left side where it says my CAW concerns. So most patients are coming with questions about an integrative approach, herb supplements and diet nutrition. But anytime patients come into integrative medicine, it's an opportunity. It opens the door to other conversations. If patients are asking about diet, quite often they're asking, should I do a paleo diet? Should I do a ketogenic diet? That's an important kind of question to answer, but it's also an opportunity to give education about what the evidence is behind, for example, a plant-based whole food diet and how that's where the evidence is strongest in terms of supporting their health both during and after cancer treatment. I'll share this framework just as an idea in terms of the conceptual side of how we do the evaluation and discussion with patients. So the idea is that there's a link between diet, exercise, our mood, sleep, and any symptoms that are experienced, for example, fatigue. And so we use this visual tool to help patients understand how these health areas are all interlinked and what kind of conversations can be had with physicians in terms of not just their cancer treatment, but also health areas that can impact how well they do and how physically and mentally. So I'll go into some of the ASCO guidelines that are out there, and this is one of the set of guidelines that specifically speaks to where is the evidence and recommendation in terms of exercise, diet, and weight management. So with the 2022 recommendation is that exercise, especially aerobic and resistance during active treatment with curative intent can mitigate the side effects of cancer treatment. For example, can reduce fatigue, improve cardiorespiratory fitness, improve quality of life, and reduce anxiety. It's a moderate to low evidence with a strong recommendation. And so exercise really is one of the main areas where we can really have a strong impact on patients, not just in terms of improving their health during treatment, helping with fatigue, but there are also opportunities in patients, for example, that might be inactive and obese to then also have conversations about how exercise can be a part of their lifestyle even after cancer treatment to improve outcomes. And many of you may already be familiar with the recent results. So the structured exercise after adjuvant therapy for a colon cancer study, it was a structured exercise program as compared to health education. In the exercise group, there was both greater disease-free survival and overall survival. The primary endpoint for the structured exercise intervention was the disease-free survival. And so more and more the question is, now we have evidence to show that there's an importance of an intervention, lifestyle intervention like diet and exercise in this case, but how does that actually get translated into having patients engage more meaningfully into their, not just doing exercise, but the right kind of exercise, the right dose of exercise. So moving back to ASCO guidelines, so the Society for Integrative Oncology over the last several years has partnered with ASCO to put out guidelines looking at integrative therapies during cancer treatment. I'll go over those, and then you all can go more into those if you want to afterwards, but this is going to be a kind of a brief highlight of each of these guidelines that have been put into place, and there are more to come. So the first set of guidelines were specifically speaking in the space of during and after breast cancer treatment, what are the integrative therapies that are recommended? So I highlighted here music therapy, meditation, yoga for anxiety, stress, meditation, yoga, massage, music for depression, mood, and meditation and yoga for quality of life. Again, this is specifically speaking to the evidence in the area of breast cancer. Afterwards, the next set of SIO ASCO guidelines, we're looking at integrative therapies for the management of pain. So I highlighted the ones that are at intermediate quality evidence and moderate recommendation. So you have, for example, acupuncture should be offered to patients experiencing aromatase inhibitor joint pain in breast cancer. Also for general cancer pain, the recommendations of the use of acupuncture, acupressure, and reflexology. And then for procedural pain, hypnosis may be offered to patients experiencing procedural pain in cancer treatments or diagnostic workups. At MD Anderson, we'd actually done a trial looking at the use of hypnosis to actually reduce the use of general anesthesia in individuals having segmental mastectomies. And then also massage may be offered to patients experiencing pain during palliative and hospice care. Additional guidelines, the next set of guidelines that came out were specifically looking at the management of anxiety and depression. This was broken down of anxiety and depression, both during active treatment and after treatment. The highest level, was high-level evidence and then strong recommendation was for mindfulness-based interventions across the board. Yoga had a moderate level of, intermediate level of evidence with a moderate level of recommendation. And that was also across the board seen as beneficial in terms of patients both during treatment and after active treatment, but then also both for anxiety and depression. And so this kind of guideline and this kind of breakdown is a helpful way to guide decision-making in terms of getting patients to the right kinds of therapies based on evidence. I will say though, the challenges as I highlighted in yoga here, so here it says yoga. If you go into the fine print, the majority of the data that's showing benefit of yoga for anxiety and depression is in breast cancer, but the evidence is much lower in other cancers. And so this yoga recommendation looks like it can be applied across all cancers, but there's that kind of a small text print, which is really the strongest evidence is in breast cancer. So there's still a lot more that we need to learn about the integrative therapies when we move beyond breast cancer, which is where a lot of this integrative medicine research the population most integrative medicine research has focused on so far. So most recently, published guidelines with fatigue. Here we have exercise recommended both during active treatment and after active treatment. That post-treatment category is a new category that wasn't in the prior guidelines. Post-treatment meaning in individuals who have end-of-life or advanced cancer and are no longer on a curative cancer treatment. But exercise, both during and after cancer treatment, cognitive behavioral therapy, and mindfulness-based programs, all of those received a high level of recommendation in terms of where the evidence. And now I did want to highlight the part here where it says interventions clinicians should not recommend. So no wakefulness agents like modafinil, for example, or psychostimulants like methylphenidate, L-carnitine, or antidepressants during active treatment, and also after active treatment, no wakefulness agents or psychostimulants. And there's a tendency to go for the psychostimulants first, but we should be thinking about these integrative therapies, including exercise, as high level and safe. Here, this is a summary in terms of putting together the ASCO-SIO guidelines with the NCCN guidelines. A lot of the NCCN guidelines, if you all had a chance to look at, in terms of the specific, not the cancer treatment guidelines, but the symptom management guidelines are bringing in more of the integrative therapies into those guidelines based on increasing evidence. And so here you can see, for example, if you look at the category of yoga, there's evidence, if you look at the moderate to high evidence, across pain, arthralgias, fatigue, anxiety, sleep dysfunction, nausea, cognitive dysfunction, and hot flashes, night sweats. That's if you look at the ASCO-SIO combined with the NCCN guidelines. The challenge I would say though with yoga is, for example, how do you find the right kind of yoga practitioner to work with a cancer patient? In our program, we have a yoga therapist, and there's more and more of this kind of evidence, of this kind of approach, which is finding how do you connect individuals with the right kind of person to actually deliver this therapeutic intervention in a safe way. And here's a general framework for the integrative oncology consultation, coming back to what I was mentioning about combining symptom management, lifestyle management, emphasizing nutrition, diet, physical activity, sleep hygiene, and stress. Looking at integrative medicine from an evidence-based approach to help with specific symptoms, so looking at what the research is, looking at where the guidelines are. It's not just about kind of one plan for everyone, right? So it's not like a kind of a preset integrative program that all patients need to go through. It needs to be thoughtfully done, personalized, based on where the evidence is and in what stage they are in their cancer treatment. And so I'll briefly highlight here. So with regard to the delivery, I mentioned that we have in our integrative medicine program support for the lifestyle intervention. There's an important aspect to lifestyle management, which includes counseling from, for example, a dietitian, a physical therapist, and then health psychologist. These behavioral health programs that combine dietitian, exercise counseling, and behavioral health support have been shown to be the most successful in terms of supporting success in terms of making changes in lifestyle, behavior change, and getting individuals to a healthier weight. I know my time is up. I'll go quickly here. So American Institute for Cancer Research is the data that we base our nutrition recommendations on for a plant-based whole food diet. We counsel patients that have questions about herbs and supplements when it comes to the herb supplement use and really try to provide the education to reduce harm, concerns about herb supplements, potential herb-drug interactions, potential organ toxicity, increased bleeding risk. So there are serious concerns that come up with regard to supplements. It's not just, oh, go ahead and take whatever you like. There really needs to be a cautious approach to understanding what the potential harms are there. When it comes to exercise, we use an exercise as medicine approach for exercise dose, and then we work with health psychology to help with that behavioral health support. So I'll end there, but again, just to come back to where the evidence is key to integrative medicine right now. There's a lot out there that can be misleading. There are individuals now using the term integrative medicine to describe what they're doing, and it's not based on evidence. And so these terms we're really holding strongly to, but we also have to be careful that there are individuals out there that are misrepresenting what they're doing because they know now, for example, that integrative medicine is suggesting something different than alternative medicine and complementary medicine. So if you have patients with questions about integrative medicine approaches and if you're yourself not sure, please do look to hopefully either in your cancer center or in your community to individuals who are making recommendations that are based on the best interest of the patient. So thank you.
Thank you, Dr.